SummitImaging is run by a US-based company. We've got a software called Endo Manager, which is basically a reporting system the doctors use for their procedures. It's a detailed reporting system. The pictures the doctors capture comes across to this PC we've got. It's a standalone or a network integrated system, whichever way you decide to go with. So I'll take you through a few features. The software lets you capture all the times for the exams, and this part is done by the nursing staff. You can capture the secum times, you can capture the patient verification times, we can capture the times where you question them about their history, and the in-room time, obviously. You can free text on the images however you like, enter your exam medications. But the main part we're focusing on is your procedure note, or the report we call it. It's a predefined template which can be customized to your liking. It consists of 6 different categories. You've got your indications, basically lets you add in the patient history. It then moves on to the description part, which is basically just an overview of what takes place from the time the patient enters into the room. Once the procedure's started and should you come across any findings, you move on to your findings, and that's where you'll be adding all of that. Next part is called diagnosis. You don't actually have to add anything in here. The system's smart enough to know what the diagnosis is depending on your findings. You can choose to overwrite the diagnosis if you think it's not correct. Once you added your procedures and your locations of where the procedures were performed, you move on to your billing part. In the billing is the standard Australian billing code, so you don't actually have to add anything. It automatically picks up the billing codes depending on the procedures that you followed. Once you've done your billing, you move on to the recommendations. This is where the doctor will be giving instructions to the patient on what to do or what not to do. Once you've got that and all the images are there, your next part will be just e-signing the report. So the good part about it is only the doctor will know the password, and no one can modify the documents without the doctor's permission. And it also has the ability to do a referring letter to the GP or whoever has referred the patient to this procedure. And also it prints out a discharge letter. If you go with the network integrated setup, it'll be on the cloud and you can access anytime, anywhere in the world.